Drug overdoses in the Roanoke Valley have been an increasing issue, especially since the beginning of the pandemic. But more recently, there's been a concern about their link to hepatitis A. WFXR's Amanda Lee has more from health officials tonight on how the two are connected.
There's a big issue in regards to the opioid epidemic in this city.
Operations Director at Brightview Health in Roanoke says their facility opened early this year because of the drug overdose crisis. They quickly gained more than 100 active patients.
It's definitely a growing issue, and it's growing faster than what we can comprehend.
The Roanoke City Allegheny Health District has seen 76 cases of hepatitis A in the last 7 months. That's much higher than normal. Infectious Diseases Director at Carilion Clinic, Dr. Anthony Baffobani, says the cases are mostly in the drug-using homeless population.
When certain drug use practices include, injecting but in an unsanitary sort of way, that increases one's risk for infections.
He says Hep A can also be easily transmitted through food.
Right from even growing up to when it is packaged all the way down, especially foods that are not heated, you can have transmission of the virus through it.
He says those who do contract hepatitis A should avoid preparing food for others. 4 people have died in the district due to an outbreak at 2 local restaurants. Health officials also warn drug users to stay away from using needles from other people, as it can add to both the hepatitis and overdose problem.
When you're sharing dirty needles, that can increase your risk of overdose and definitely other problems.
Doctors say it can all be very easily prevented by making sure you're vaccinated.
The key is if one is vaccinated, that tends to decrease or diminish the risk of even getting the disease at all.
Dr. Baffobani says most healthcare providers offer hepatitis vaccinations. Reporting in Roanoke, Amanda Lee, WFXR News.
And there's actually a vaccination clinic in Roanoke City happening tomorrow.